Health emergency declarations are in place this morning in West Africa. That's where the biggest recorded outbreak of the Ebola virus continues to spread. The World Health Organization says as many as 729 people have died so far in Guinea, Sierra Leone, Liberia, and Nigeria. That number is expected to rise.
Here at home, at least one congressman is calling for travel restrictions to those countries. The CDC has a number of quarantine stations set up at international airports across the country to screen incoming passengers for any signs of Ebola. Our medical contributor, Dr. David Agus, is just back from Africa. He's with us now from Los Angeles. Dr. David Agus, good to see you and good morning to you.
Good morning, Gail.
What makes this outbreak so different?
Well, the virus was first found in the 1970s, and every year since then, it's come out once or twice a year. And it's because the reservoir where it hides is in fruit bats, and fruit bats are a delicacy in these Western African countries. And so in most cases, they're in remote villages. So it comes out for a few weeks, and then several people die, and then it slowly goes away. In this case, though, it started in February, and it's going and growing, so now there are more cases than ever before. It is the first time it's been in urban areas, and it's actually spread to multiple countries for the first time. So this is a different kind of outbreak. It cannot be contained in the small villages. This one is growing and scary.
How precarious is it? How scary is it?
You know, this is a virus that works by going in and causing vomiting, causing diarrhea, and invading the blood vessels so you bleed. And so it's spread by bodily fluids. And by causing these bodily fluids to be out there, this virus can be spread very easily. There are cases of where somebody has died, and at the funeral, everybody goes and touches the body. Everybody who touched the body has died of Ebola. People in Africa are afraid of this, and so people are saying and hiding the symptoms so they don't have the stigma of having Ebola. Families have stolen bodies from the morgue so they can have a usual burial for their family member instead of letting them be isolated and buried so that the virus can't spread. And so we need strong education here because this is a real serious outbreak that's going to cause more and more problems.
I know you were just in Africa on vacation in a place that does not have Ebola. But did you learn anything from being in the continent?
Yeah, you know, Africa is a remarkable continent, and I, admire the people there. I admire what's going on, but on a health basis, it's backwards. The average spending per capita in these countries that are affected by Ebola is less than $20 per year. You know, when I went into Africa, I had to have certain shots so I wouldn't get things and bring it back to the United States. The current records for doing that is this. It's a piece of paper issued by the CDC and the World Health Organization with handwritten what I have. Yeah. It's backwards. When I left Africa, they asked me all these questions, and I had to go through multiple security checks to make sure I didn't have electronics that turned on and then they were powered. Nobody asked me if I visited a Western African country or was in contact with somebody who had fever or symptoms that could be of the virus. We need to change how we deal with these viruses at entry points and also on an international basis, how we deal with health care.
Really important point, Dr. David Agus. Thank you so much.